Hello everyone, it's Jenna. Welcome back for another video. In today's video, I'm going to be teaching you exercises that you can do for SI joint pain. So if you're struggling with this pain, I know how challenging this can be. I've gone through this myself before, and I have really discovered a formula that works to help to reset the pelvis, and then exercises that you can then do to strengthen and stabilize around the SI joint so that it doesn't keep going out, which is one of the issues with the SI joint. Maybe it'll feel better and then it will keep slipping out. And so my skeleton here, Sally the skeleton, and I are going to show you a little bit of anatomy around the SI joint and why this may be a major pain generator for you. Now, a lot of my clients come in and tell me that their low back is hurting, but what is actually hurting is their SI joint. And so we really want to be able to identify what kind of pain we're experiencing, where is it originating from, so that we can do the right recipe of exercises for that area. The SI joint, it is an abbreviation for sacroiliac joint. So your sacrum is this triangle-shaped bone right here that you'll see on Sally the skeleton, and this is her ilium or her hip bone, okay? The SI joint is this area right here. So on some people, you can actually feel it protruding. So if you just kind of wrap your thumb around the back and put your thumb in that area, you may feel a bone sticking out, and that can often be an indication that the SI joint is out of alignment. It doesn't always mean that, because some people's sacrum is pushed forward more than others. So the more your sacrum is pushed forward, the more this right here, I'm going to do a close-up in the camera, but the more that is going to protrude. So just because you feel it protruding, it doesn't always mean that there's an issue there, but that could be one of the signs. And the sacrum here has 1 to 2 degrees of what we call nutation and counternutation, which basically means it can tip forward and it can tip back just 1 to 2 degrees, which is very slight. So if we have more movement than that, that could be causing a problem. And the SI joint itself should have a little bit of lateral movement here. Maybe there's some movement here in the ilium where it connects, but not a ton, like 1 to 2 millimeters. And that's why this can cause so much pain for so many folks, because we have ligaments here that help to stabilize and kind of hold everything together. Those ligaments can stretch. So especially if you're a woman and you've given childbirth, or even if you haven't given birth before, your ligaments can stretch during that time of month, and this could be causing you more pain, especially if you're overstretching through maybe doing a lot of yoga, or if you're a gymnast or a dancer. I know for myself, when I was dancing a lot professionally, and at some point in time I was doing 3 hours of yoga a day, which was causing me a ton of pain. I didn't understand why, but it was overstretching my ligaments. So if you're already hypermobile, you want to make sure you're not overstretching, because you could be overstretching these ligaments. So let's talk a little bit about what is the job of the SI joint. Well, it's meant to distribute the force from your upper body, so from the spine here down through the pelvis to the sacrum, and help to transfer that load to your legs or to your lower body, okay? So it's really an important joint. You can see why, because it's kind of where heaven and earth meet, right in the middle of your body. There's a lot of energetics when it comes to the SI joint because of this, because it also correlates with our second and third chakra, and that has a lot to do with our self-confidence. It has a lot to do with our sexuality, and it has a lot to do with our grounding and our base, which is our first chakra. That's also connected. So you want to consider also the energetics of this. If you have been struggling with this for a while, you could maybe look at what areas in my life am I just not moving forward, or where I'm too afraid, or maybe have a lot of inhibition around moving forward in ways that I know would be really healthy for me in my life. So that's what I would say in a more kind of metaphysical sense. If you want to work with that a little bit more, I would definitely suggest journaling about that and exploring that as well with a coach or a therapist. So another thing about the SI joint, and one of the reasons why it could be maybe hypermobile, hypermobile means it has too much movement, is because the body was designed to have the right recipe of stability and mobility. So for instance, our hip joint is supposed to have a good amount of mobility so that then the lower back and the pelvis can be stable. So the SI joint is actually a stabilizing joint. It has a teeny bit of movement, as most of our joints do in our body. Even if they're stabilizing joints, they still move, and yet we don't want it to have too much movement. So if you're lacking mobility in your hips, like you're sitting a lot at a computer or a desk throughout the day, then this would be something you might want to check out. Is because of my lack of range of motion in my hips, is my SI joint compensating for that? And sitting can also put a lot of strain and force on the SI joint, especially if you're sitting maybe with your pelvis tucked under or with improper biomechanics, which most people are, if you are sitting a lot. Another reason why you may be experiencing SI joint pain is your hips might be unlevel. And that can cause more wear and tear or kind of uneven strain and force through that one side. And what we often see with the SI joint is one side is too mobile and one side is not mobile enough. So it's called hypermobility and hypomobility. And we see that pattern a lot because they're trying to compensate for each other. And this can get kind of complicated. Like I said before, the sacrum can be tipped forward, tipped back. It can also be twisted. That can come from a lot of different places. It could come from a past injury. So if you've had a major fall or if you tripped and fell on your knees, then that can kind of throw things out of alignment. You could have a fixation in your spine or in your back. So if you are struggling with this, I would definitely suggest to see a healthcare provider or a movement coach that can really help you with this. And if you would like to reach out to me for more support, I'm happy to work with you. So click the link below and you can get more information about how to work with me. But with that said, let's go ahead and start with resetting the pelvis. This is an osteopathic technique that you can actually do on your own. And I'm going to show you what props we will be using today that are helpful, but you don't need to use all of these props. So if you don't have these props lying around, I'll show you the alternative. So this is a dowel that we've made that has styrofoam around it, so it's nice and soft, but all you really need is something like a broomstick. Then I have a band. So I'll show you a few different options that you can use for these. This type of band is the easiest and cheapest one to find. You can get these at most sporting goods shops. You can also get it on Amazon. I'll put a link below. And this is just like a stretchy TheraBand. This one's a little bit nicer. It's made out of fabric. You can also get these on Amazon. And this one is called the Hip and Core, and this has a really good amount of tension. So I will link this one as well, but what you just need is the most simple type of band, and if you don't have one of these loops, then just grab a TheraBand and you're going to be tying it around your legs. You'll also want a yoga block. If you don't have a yoga block, that's fine too. You can use a pillow or just something to put between your legs. I will also link that below in case you want to grab one of those. So you're going to take all of these props, you're going to place them near your mat, and you're going to go ahead and start with the dowel and lay down on your back. So you're going to take the dowel, and what you're going to do is place one leg over it and one leg under it. You want your legs 90 degrees right over your hip sockets and your tailbone heavy. And what you're going to do here is a push-pull. So I'm pulling with my left thigh, pushing with my right. I want to give myself a good amount of tension there to hold the dowel so it doesn't slip. And I'm holding for 2 breaths. So I did my 2. And then I'm going to switch. Same thing here. So knees are over the hips. I do a push-pull. So here I'm pulling my right thigh into the dowel, pushing my left thigh against the dowel. This resets the hips. So if your pelvis is rotated, that is going to help with that. Okay, so now I'm going to grab my block. I'm going to do first the most narrow width of the block. I line up my heels with my sitting bones. I make sure my pelvis is equally weighted on both sides. We don't want the pelvis rotated. That's one of the reasons why you may be experiencing SI joint pain, and so we want to balance that out. One way you can feel that is to bring your hands to your hip bones. Just notice, do you feel one side's higher than the other? We also want to be in a neutral spine, which means you're not too tucked under and you're not too arched. You're just in that nice Goldilocks position with your pelvis. From there, I'm going to squeeze my thighs into the block. Again, hold for 2 breaths. Inhale through the nose and exhale. Inhale and exhale. I'm going to relax, flip the block. Now I'm going to, this would be the widest position, this way. I'm going to go this way, the second widest. Put that between my thighs like a cassette tape. If you know what that is, remember what that is, you're going to squeeze your thighs into the block and hold. Long, deep breaths. Keep squeezing. And relax. Now I'm going to grab my band. If you need to, you can go ahead and tie the band around your legs if you just have a regular TheraBand. Otherwise, if you have a loop, then put the loop around your thighs. Bring your feet about as wide as your outer hips. I'm going to this time push my thighs out into the band. Long, deep breaths. Last breath. And release. Good. How did that feel? You may already be feeling better just from breathing, relaxing, and doing that reset. Okay? Now we want to try to keep that adjustment that we've just created in the pelvis. So we're going to go ahead and start to strengthen the glutes and strengthen the muscles around the hips. So we're going to go back to our block. Take your block, place it between your inner thighs again, the narrow width, so that your heels are lined up with your sitting bones, arms are pressing down at your sides, shoulders are dropping back into the mat. Take a deep breath in. As you exhale, start to curl your hips up off the mat. You're going to make your way into a bridge. We're going to start with a lower bridge and see how that feels in your SI joints. Good. And then we're just going to bring the pelvis down in a more neutral spine. So usually when I do this, I roll up and down, articulating the spine, but here I'm just going to lift and lower the hips instead, keeping a more neutral spine to keep those SI joints in that nice stable position that we have just created. So I would suggest doing 8 of these, squeezing the block, coming up and down. And after you've done 8 of those, come to the top of your bridge, squeezing into that block, and you're just going to hold that position and breathe, feeling your glutes working, drawing the abdominal wall in, and visualizing the transverse abdominis that wraps around your torso. It attaches to your spine and its fibers go down into your sacrum and connect to your multifidi. So all of this is very connected. It weaves into the SI joint and helps to support and stabilize it. So I really like to use that visualization. I find that to be key in helping with this healing process so that your SI joints can kind of come back into their ideal alignment. Go ahead and lower your hips back down. We're gonna do a bridge again. Now, again, going back to our band or loop. Feet are about as wide as the outer hips this time, so not as narrow as we had them before. Press your thighs out, curl the hips up, really press into those heels to activate the glutes. We're gonna breathe. I'm just holding this one and I'm pressing my thighs out. So I'm not going up and down this time. I'm just keeping the bridge, maintaining this diagonal line from my shoulders through my knees, feeling those glutes working. Your glutes are the muscles that help to stabilize your SI joints. So really important that we work these muscles when it comes to SI joint pain, because for a lot of people, the reason why we are having this pain in the first place is our glutes are weak because we're just not recruiting them enough, we're not using them enough throughout the day. Maybe we're sitting on them throughout the day. That actually changes the fascia and changes the tissues. So we want to get nice strong glutes to support our SI joints. You can take that off your legs. Very good. So now we're going to do some side lying exercises. So what I would suggest doing now is maybe walk around and see how your body's feeling. And you may decide that you don't want to move on to these next exercises, that you just want to end there and see how your body responds to what we've done today. Otherwise, if you like the work that we're doing, it feels good in your body, and you want to keep going, then we're going to go ahead and do some side lying work. If you're new to these side lying exercises, I would suggest doing these without a band. But if you've done these before and you're already doing Pilates or a lot of exercises that you're doing PT, you're already doing these for your SI joints, then I would say put the band on, because you've already developed a certain level of hip strength there, and now you want to increase the strength. So you're going to go ahead and bend your knees, line up your heels with your sitting bones, take a deep breath in, and as you exhale, lift your leg up into that band. So these are called clamshells. I'm keeping my heels together, keeping my hips stacked, one hip on top of the other hip. And I'm also keeping a little mouse house under my bottom waist. That allows me to maintain a neutral spine. It keeps the top waist nice and long. I'm drawing my abdominal wall in. And I would say do about 8 of these. You really want to feel like you're working from your deep lower hip rotators. If you bring your hand or fingers to your sitting bone, then you should be able to feel those muscles working. The next one we're going to do is to straighten that top leg, flex the foot, reach out through the heel, and lower and lift the leg. So again, I'm keeping my top hip over my bottom hip, continuing to keep my hips stacked as I lift and lower that leg. Good. You want to feel the work here in the side of your hip. And again, if this band feels like it's just too much, then go ahead and take it off and just try it without that. You want to make sure as you're doing these exercises, your hips aren't rolling, so you're stabilizing your pelvis, and that's going to help to keep your SI joint stable so that it's not shearing each time you're going into a movement. Okay, so we're going to give the hips a little break. Bring your knees just slightly closer to your chest. Bring your top arm up to the ceiling and rotate the chest open. We want to keep the hips stacked. So if you're feeling it in your SI joint, that means you want to make the movement a little smaller, because maybe now you've started to rotate the pelvis, and maybe you just bring the arm back a little bit. You don't go very far. But when we can increase this range of motion in our upper back, just like I said earlier, our body wants to have the right recipe of stability and mobility. We want a nice mobile upper back so our lower spine and pelvis can be stable. So this exercise is about helping to increase that mobility in your thoracic spine by allowing gravity to help you go into more thoracic rotation. So I would do about 3 of those. I'm cutting a few of these exercises short just for the interest of time. but you can pause the video and do more reps if that feels good for you. I like to start folks out with 8 of each just to see how their body responds to an exercise so they don't overdo it. And then you can start to add on from there. Let's try that on the second side. The hips are stacked. You have a little mouse house under your bottom waist so that your top waist is long. Your abdominals are drawn in. As you exhale, lift the top knee. As you inhale, lower it down. You again want to be thinking about working from those deep lower hip rotators, which are right around the sitting bone area. I always recommend breathing as you're doing these exercises. Let's do one more here. Very good. So now you're going to straighten that top leg. Flex your foot, reach out through your heel, and you can even look and make sure that your heel is in line with your sitting bone. And then from there, again, you're going to lift and lower that leg. Keep taking the leg back towards the wall behind you, because inevitably the leg is going to want to swing forward from those tight hip flexors that want to dominate every movement, and instead we want to fire those posterior chain muscles, the glutes. Let's do 2 more and 1. I'm sure you're feeling those glutes down. Let's give your hips a break. Bring the top arm up to the ceiling. Take a breath in. Exhale, rotate your chest towards the ceiling. Good, and paint the sky as that arm comes back down. Again, inhale, the arm will lift. Exhale to rotate. And slowly bring the arm down. One more time, arm will lift. Rotate the chest open. And allow the arm to come down. Very nice. Okay, so we did a lot of strengthening for the glutes. We did some mobility work for the thoracic spine to help the lower spine stabilize. And now we're going to stretch the QL. The QL is an important muscle when it comes to the SI joint. So we want to stretch the QL muscles because they attach to the top of the pelvis, which, like we learned earlier, is that ilium that attaches to the sacrum. That's your SI joint. If those muscles are tight, that might be pulling on that ilium and pulling it out of alignment. So we're going to do an exercise called mermaid, which we start in a Z-sit position. If this position is uncomfortable for you, then you could try bringing one leg out to the side, or you could even sit in a chair. I have a video I'll link below called Office Yoga, where I give you some examples of some nice side stretches that you can do using a chair. One more modification is using a block and sitting on that yoga block if your hips feel more comfortable that way. So come into your Z-sit position, bringing the left leg forward, the right leg back. From there, you're going to bring your left hand down, your right arm will lift, and you're going to come up and over into a nice side bend. You can bring your forearm down if that feels good for you. Otherwise, you can be a little higher up on your hand. Take a deep breath in, really elongate your spine. Exhale, come up and over to the other side. Nice side bend here. So if any of these exercises feel like they're putting more stretch or strain on your SI joint, then I wouldn't do them. I would maybe omit this one and move on to the next one. But if this is feeling good, it feels nice to stretch your QL, then keep doing this one with me. We're going to do one more set, lifting and lengthening, and then coming up and over to the other side. Beautiful. As you inhale, you're going to slowly come back. And let's go ahead and do that on the other side. So the leg that's going back, that's creating internal rotation of your hip. If you don't have enough internal rotation of your hip, which is what happens often in arthritis, then that could also be putting strain on your SI joint. So if it's not painful for you to sit like this is actually a really good movement for you to do to work on that internal rotation of your hip. Let's go ahead and bring the right hand down this time. If it feels good, you can go ahead and come down onto your forearm, going into that side stretch, reaching your left sitting bone towards the mat, breathing into the side of your ribs. Slowly come back up, and let's do that on the other side. Inhale to find length, lifting the ribs out of the pelvis. Again, another way to take the pressure or the force off of that SI joint. Come up and over, drawing a rainbow overhead as you reach out through your fingertips. Big stretch there. Inhale, find length, exhale, and reverse. Very nice. Okay, let's go ahead and come on up from there. And we're gonna go ahead and come down onto our forearms, bringing the elbows under the shoulders and the knees under the hips. From there, your right leg will lift. This is called a kickback. So I flex my foot, I kick the leg up towards the ceiling. I'm trying to shine my kneecap down and my heel up. Drawing the abdominal wall in, exhale to lift, inhale to lower. So this is another glute strengthening exercise. You want to make sure as you're doing this one that your neck stays long, your gaze is down, chin is slightly tucked. I'm going to take my knee out to the side and down, out to the side. So this is similar to that clamshell we did earlier, but the difference is that we're doing it in a less stable position. So you really want to be thinking about keeping the headlights of your hip bones pointing straight down. Let's go for 2 more and 1. Good. Let's go ahead and switch sides. Left leg lifts, and you're going to flex the foot, reach up through the heel, keep the neck long, creating that diagonal line through your spine. Let's go for 3 more. 2, 1, and knee out to the side and down, out and down. Really try to keep both hips square towards the mat for 2 and 1. Good. Bring that knee down and bring yourself on up. And from here, we're going to go into bird dog. So you want to find your neutral spine. Keep your tailbone lifting towards the ceiling, the abdominals drawn in, the neck long. As you exhale, you're going to take your right leg back, left arm forward, really stabilizing the pelvis and shoulders. Slowly bring that hand down and bring that knee down. Let's switch sides. Left leg extends back, right arm reaches forward, hand down, knee down. So if this is your first time doing this exercise and you're feeling this one in your SI joint, here's how I would suggest doing it. Slowly drag the toes back as the fingers drag forward. Pull it under the hip and the shoulder and switch. So you're just practicing reaching your limbs away from your center without shifting or changing anything. So you can imagine you have 2 bowls of water, one's on your shoulders, one's on your pelvis. Keeping the water bowl still, nothing's moving. Once you feel like you have that, then you can start the lift and go back to the drag. Drag away from your center, lift, down, drag in. Very good. So just take a moment to check in with your body, see how things are feeling. You might want to come up to standing. If you already feel like maybe you've done a little too much, then I would stop there. So exercises can be very individual when it comes to pain relief, and everybody's going to need something different. If you want more support with this, feel free to reach out to me if you would like to have an individualized plan or recipe of exercises that you can do that are specific for your body. Okay, so now we're going to come up to standing. We're going to take that band and put it around the legs right above the knees. You may already be familiar with these. These are called monster walks. And we're just gonna go to the side. This strengthens the muscles on the side of your hips. And we're just going to keep walking side to side like that. So as you're doing these, you want to think about pelvis is stable, so it's not rotating front to back. It's helpful if you have a mirror that you can do these in front of so that you can check out your pelvis. But another way to check in with your hip stability is just keep your hands around your hips. So I'm in a squat position. I'm not going as deep as I can go. I'm in kind of what I call the mini squat so that I am showing off my ducktail feathers. I'll do a couple to the side so you can look at the alignment of my spine. Engaging that transverse abdominis muscle that wraps front to back as we talked about before. Very nice. All right. So we're going to go ahead and from there do one more stretch for the psoas. The psoas is another important muscle when it comes to the SI joint because it's a muscle that connects the spine and the hip. SI joint also does that. So we're going to come back down onto the mat, onto our hands and knees. So let's start here in a lunge. You can bring one foot forward, the other leg back. Tuck the back toes under to protect your back knee and begin to soften your hips down towards the mat. You should start to feel a stretch in the front of your back hip. So those are your quads, the attachment of your quads, which we call the hip flexors. If you want to go deeper in the stretch and get more up into the psoas, you'll want to come vertical through your spine because your psoas attaches through your diaphragm up here. So if we bring the spine into a more vertical position, then we can get more of that stretch in the upper psoas, which can possibly take some of the tension off of your low back and your SI joint. Good. Okay, so we're going to go ahead and try that on the other side, starting with that low lunge, just sinking your hips down. It's important here that you make sure that your pelvis is square because, again, we're trying to avoid rotating the pelvis. Go ahead and come on up. Bring your hands onto your hips. If this feels challenging here, with the balance, you can bring one hand onto a wall and use the wall for support. Keep gently tucking the pelvis under, drawing the lower abdominals in as you go a little deeper into that stretch. Beautiful. And go ahead and release that stretch. So that's what I have for you today. We started with a reset for the pelvis to maybe bring the SI joint into a better alignment. Then we did a lot of hip and glute strengthening exercises so that you can maintain that stability in your pelvis. Then we did a couple stretches like that QL stretch and the psoas stretch to address any tight muscles that maybe are pulling on the pelvis in a way that's causing an imbalance in the hips. And I hope this helps. So comment below and let me know how these exercises felt for you. And if you would like more support with this, if you want your own individualized recipe of exercises that you can work on, feel free to reach out to me. I'd love to hear from you. The link is below. And please also like and subscribe to my channel. It really helps this channel to grow so that other folks can also benefit from these videos. And I will see you next time. Take care.